Good morning, everyone. This is Dr. Sophia Beecher, and let's get to the truth of it. So, had a little bit of challenge setting up the video this morning because I am in my backyard. Um, anyway, so today we're gonna kick off Autism Awareness Month by talking about common dental problems in autistic children. So, first of all, autism is a neurodevelopmental disorder commonly affecting express language and communication and interaction with other people, and it's about 1 in every 160 people that is autistic. So what that means really is that you probably have an autistic relative, an autistic child, and you probably don't even know. If you ever have any doubts, early screening is critical, early intervention is critical. Speak to your pediatrician, okay, and they can guide you. And being in denial doesn't ever help. All right, so today I'm going to be speaking in a couple capacities. One as a dental health professional, a dentist, and the other one as a mother of an autistic child. Okay, so common dental problems we're going to be addressing today are cavities, soft tissue trauma, tooth grinding and clenching, and dental anxiety. So for cavities are simply caused by plaque buildup, and plaque is an accumulation of the food and the bacteria that settle on your teeth, and over time it starts to produce acid which melts away at the enamel, and then you end up with a hole in the tooth or a cavity. Now, in autistic children, there may be some got a message. In autistic children, there may be some dietary challenges because some of them tend to be picky eaters. Okay, so parents may find that they'll be more inclined to just give the child whatever they want to eat because they have so much trouble providing a healthy diet for them, because they have taste aversions, they have textural aversions, and if it is a child has all of those and what they want to eat is something that is very soft or sticky or sweet all the time, then you will have a lot of plaque buildup, and if that's not being cleared away by the parent assisting with brushing, then you'll end up with cavity formation. Right? So what is the solution? Well, firstly, there are no simple solutions to this, as any parent that has a picky eater can attest to. But what you can do is to start to introduce your child to a variety of foods as early as they can take solid foods. And what that does is that helps to broaden their palate. Okay, what that does is that it helps to broaden their palate, and it may encourage them to like a wider range of foods, right? The truth is that if your child has aversions to taste and textures, no matter what you may do, they may still not want to eat a broad range of foods. And if that's the case, you may need to work closely with a pediatrician or a nutritionist, right? Or you may find yourself having to try everything until something works, which you may still have to do anyway. So it's really a challenge. But until that happens, where you can steer your child away from foods that are more likely to cause cavities, what you can do, as we said before, is assist with brushing twice a day with a fluoride toothpaste until that child is old enough to brush for themselves, which is usually around age 7 or 8, or when they have the dexterity to tie their shoelaces. All right, so tooth grinding or clenching. So autistic kids may have a lot of issues with anxiety, and that may lead to clenching their teeth when they're awake, or it may lead to grinding their teeth when they're asleep. There is really not a simple preventative strategy, because for people that grind or clench, what we normally recommend is a night guard, and they may have issues with complying, like wearing that night guard. What can be done, which may not be 100% foolproof, is that you can get your child behavioral therapy, and what that will do is it will give them coping skills and possibly decrease their anxiety, so they may not need to clench their teeth or grind their teeth in their sleep. However, this can still be a very, very difficult thing, and a lot of the times what we end up doing as dental professionals is just treating the effects of the clenching and grinding, which we do on the basis of the symptoms. So whether the patient is having pain or swelling, and it may involve very, very complex restorative treatment, so root canals, full mouth crowns, that kind of thing. So it can be a very destructive process. All right, so the next thing is soft tissue trauma. So a lot of autistic children, they have non-nutritive habits. So they will put things that are non-food items in their mouth, which they may actually eat, in which case we call it pica or pica, however you want to pronounce it. And that can lead to a lot of issues, including damage to the teeth, damage to the oral tissues. Also, they may have habits like lip picking or lip biting, which can also cause damage to the oral tissues. So the causes of this, again, some of the times anxiety, some of the times just the repetitive behavior because of the disorder. And in terms of interventions, again, behavioral therapy just to help with general coping. Also, restrictive diets have been suggested. Not going to get too much into that. And some people have recommended vitamin supplementation or maybe even certain medications. So, sorry, I have my little list here. Alright, so the next one is dental anxiety. I mean, who doesn't have anxiety for the dentist, right? But autistic children, they may have more difficulty in the dental environment for several reasons. Number one, it's an unfamiliar environment for a lot of them, because parents may tend to bring them to the dentist very, very late because of fear that, people won't be able to manage them, and sometimes they've actually been turned away by professionals, unfortunately. Also, apart from the unfamiliar environment, they can be overstimulated quite a bit in the dental environment. We have bright lights, we have loud noises, which, some of them may have sensory issues. So bright lights, loud noises, weird taste. Remember, a lot of them have taste and textural aversion, so maybe even the paste that we use to polish their teeth or the fluoride gel that we want to give it may taste very disgusting to them, so they may actually hate it. So what can we do? Again, no simple answers, but a good thing to do is to bring your child to the dentist early. Number one, it can help to desensitize them, and this may be a long process, and for some children actually they may need a pediatric specialist to do this with them over time. Another thing that that is beneficial in terms of bringing them to the dentist early is that we can give advice in terms of oral hygiene advice, dietary advice. We can spot problems in the early stages, which would mean less intense treatment, which would be a good thing for everyone. Some of the times, though, unfortunately, depending on the severity of the autism, we may not be able to do treatment unless the patient is sedated or under general anesthetic, which would again be in a specialist practice. So as a parent, the take-home message is prevention, prevention, prevention. So what can you do? Assist with brushing. Ensure that you're brushing with a fluoride toothpaste twice a day. Ensure you're helping with flossing. For children older than 6, you can give a fluoride mouthwash, and that's very helpful also. Younger than 6, we don't want to give them mouthwash because there's a risk of them swallowing it. And do your own inspection at home. Look at the teeth, see if there are any black spots, see if there are any holes, right? And bring your child to the dentist early so we can give pertinent advice and assistance. All right, thank you so much for listening this morning. Have a good day, and during Autism Awareness Month, think to yourself that in a cruel world, it doesn't cost anything to be kind. All right, bye.